Joining us today is Dr Alison Chiu, one of our ophthalmologists who is an eye expert. Now, I often get asked by many patients, when should I see an ophthalmologist for an eye check? So I would like to ask Dr Alison Chiu, are there any times in a patient's life that you recommend they should be getting a review or an eye check by an ophthalmologist?
So generally, if the patient is well, has no coexisting medical illnesses and no sort of history of ocular disease, then a general check should be done at age 50. If there's a strong family history of glaucoma, for example, then that first check should be done at age 45. It's really important also to screen children because the visual system is still developing and there is a chance to have a big impact on improving a child's vision before it becomes too late. So generally that can be done at any stage, but given the developmental stages of children, a good age to do it is 4 because they can be cooperative and you can ensure that you get a good, reliable exam.
GPs should, in fact, at the 4-year Healthy Kids check, be requesting or suggesting an eye check at that point. So it is a good opportunity to assess their vision, I imagine colour blindness, whether or not they've got strabismus, etc.
Exactly,
Okay, cool. I have a lot of patients that either have diabetes or they have blood pressure problems, and I always wonder if they're obviously more at risk of having eye disease. Is there any particular time that you suggest that they should be getting an eye check?
Yeah, so patients with diabetes should have an eye check when they're diagnosed with diabetes because, as you know, often they have had diabetes for a while before they're diagnosed. Patients with high blood pressure, if it's well controlled, then they can be in that pool of people that have their general check at age 50. If, however, the blood pressure control is brittle or not well controlled, then it should be done at the time of diagnosis as well.
Cool. And when someone comes in for an eye check, what exactly does an eye check involve? What is a comprehensive eye check?
So that involves a vision test, an examination of the anterior part of the eye, the slit lamp, then the use of dilating drops to dilate the pupil to allow an examination under the microscope at the slit lamp of the posterior segment of the eye. Depending on what's found, then ancillary tests can be done, such as a field test or a scan of the retina and those sorts of things.
And just in general, is there any advice that you can give to patients out there to keep their eyes generally healthy?
General lifestyle measures, just like everything, no smoking, healthy diet.
Eat well.
Eat well.
Have your vitamins.
I mean, particularly there's a lot of discussion about dietary supplementation for people that have macular degeneration. So look, the big studies show that those supplements like MacuVision and Lutein Vision are only beneficial for people that have certain categories of those diseases. However, you can also replace those supplements with a diet that's high in green leafy vegetables, so around 4 servings a week, and a diet that has at least 4 servings a week of fish, and that can include tinned fish like tinned tuna or tinned salmon.
Okay, so omega-3 fatty acids, vitamin A, vitamin C, lutein, antioxidants. They're all the good things. What about sunglasses, very quickly? What sort of sunglasses, if someone asks you, what do you recommend? I found a lot of the cheap ones are really cheap and may not be protecting our eyes. Is there anything that we should be letting people know about sunglasses?
Yeah, so just as long as they've got UV protection built in.
Okay.
I mean, obviously the wraparound sunglasses
or
style
Jackie O.
is better because it stops light coming in from the side. Sunglasses are also a fashion statement as well as for sun protection, so it's just finding a balance between that.
Awesome. Well, that's Dr Alison Chiu talking to us about healthy eye checks.